Hi all, I'm Dr. Melissa, and at Dr. Melissa's Kitchen, I talk about all things lifestyle medicine and integrative psychiatry. So let me first tell you the difference between lifestyle medicine and integrative medicine. So I get this question a lot, and most of the time people don't know because there's a lot of overlap. So both of them do talk about healthy nutrition, movement, sleep, and avoiding toxins and substances. Lifestyle medicine is very plant heavy, plant strong, and showing the evidence in regards to the Adventist health studies, the EPIC studies, the nurse health studies, and these were done most of the time under, I would say, in population settings, either in the blue zones or Adventist studies or nurse populations. And they were able to check for patterns and food frequency questionnaires to see which healthy foods and what types of lifestyles had the lowest rates of heart disease, diabetes, hypertension, even low rates of mortality. So that's the foundation of lifestyle medicine, and often the trailblazers of those types of, I would say, thought leaders and science and how they implement it. You often see Dr. Esselstyn, Dr. Ornish, the China study, Dr. T. Colin Campbell. So these are the people who really paved the research and the studies. Big fan of Forks Over Knives and What the Health. And there's some new ones like Game Changers, and these are documentaries that show that even heavy bodybuilders can thrive off a plant-based diet, and they can be strong because they are eating protein from plants. So that's usually the foundation of lifestyle medicine. Actually, on my website, drmelissamandela.com, a list of all the resources that I've compiled, and that includes documentaries, books, that it also includes handouts and other tools. So if you're interested, you can check there. In the integrative medicine world, you can see that there is another layer besides lifestyle medicine. There's mind-body medicine, there's energy medicine, another emphasis on meditation, which lifestyle medicine does incorporate. Lifestyle medicine incorporates resilience as well, but integrative medicine has an emphasis on herbs and supplements. It's actually a 2-year trainer compared to lifestyle medicine certificate and board exam, maybe just 1 year. And that 1 year is really critical to find out which patients that I've actually been able to implement it in. And then there was the lifestyle medicine fellowship, which I did at Loma Linda, which was 1 year, and that had to do with all the inpatient, outpatient specialty clinics, working in the VA and the FQHGs, which are patients that couldn't afford access to care, that may struggle, and they were below the poverty line, usually the Medicare, Medi-Cal, IHP population. So I was able to implement it on people who were on a tight budget. First of all, blueberries are fruits, which my patient didn't know, and salads are a type of mixtures of vegetables all in one. That was my lifestyle medicine experience. And then once again, integrative medicine, I do practice it at Dr. Lifestyle. Dr. Mike Yu does that as well. And I'm deciding to take a fellowship again. I love learning. I did an integrative psychiatry certificate in between, and that was very fascinating. It did incorporate a bunch of other principles in the functional medicine, naturopathic, personalized medicine world, but integrative medicine is another 2 years. So if you do all the math, I've literally been in school forever. I went to college, right, at UCR for 4 years. I did a master's in biomedical science, a master's in health administration, and then 4 years in medical school. After medical school, I went into family medicine, which was 3 years, and then lifestyle medicine, which was the 4th year, and then primary care psychiatry, 5th year, integrative psychiatry, 6th year, and then another 2 years in integrative medicine. If you calculate everything, 17 years. 17 years. That's how much I've done in my training to get where I'm at, and it just keeps going because it's such a humbling experience, because sometimes we have to look at the evidence and find other tools and find out resources, because most of the time my patients have seen so many other doctors, 3rd and 5th opinion, or they're just trying to find a doctor that can work with them through their struggles and through things that they may not feel comfortable seeing their doctors, their traditional doctor, finding ways to problem solve and finding out other tools that are safe and evidence-based. If you're looking to do something different, I'm your doctor. If you're looking for some support in the integrative way, if it's lifestyle, primary care, psychiatry, I'm your person. And I do some functional medicine tests as well. So I can't wait to just take you on this journey to talk about all the differences between what I do, but also the overlap. So if you want to learn more, follow me at Dr. Melissa's Kitchen.